Good evening, everyone. My name is Tarina Harris. I am the program director for Nia Cultural Center, and we're super excited to have you all join us for tonight's African American Read-In. And so this is a series that we celebrate every year during the month of February to really encourage our community to familiarize themselves with our local Black authors from different interests and backgrounds and different genres. And so I'm super excited to be able to host tonight. And I'm going to pass it over to Clement to introduce Dr. Napoleon Higgins. Clement is a student at University of Texas Medical Branch, and he also shares an interest and background in psychology and mental health as a broader study. And so I'm really excited to have him join us tonight to welcome in our office.
Hey everyone, it's a pleasure to be here with you today. I'm going to briefly introduce Dr. Higgins. So Dr. Napoleon Higgins Jr., MD, is a psychiatrist in the Houston Clear Lake City area. He currently serves as owner, CEO, and president of Bay Point Behavioral Health Services Incorporated, Houston Research Group Incorporated. He also practices as the medical director of Hold My Hand Residential Treatment Center and as the staff psychiatrist at Peer Review A&M and the Student Services Center. Dr. Higgins specializes in treating mental health disorders through medication management, psychotherapy, and behavioral training. He treats mental while considering everyone's individual situation and personalizes treatment to fit a patient's individual needs. He works with patients on nutrition and how living affects mental and physical health. He has helped many lose weight and improve overall mental and physical well-being. He teaches how to improve your metabolism, thereby causing weight loss and improving conditions such as diabetes, high blood pressure, and high cholesterol. He truly believes that you have to treat the whole person and that the mind and body are connected and that both have to improve in order to reach optimal mental health functioning. In 2015, Dr. Higgins completed his first book entitled Transition to Practice, 21 Things Every Doctor Must Negotiations in the Job Search. The book relates to the needs for doctors to know how to navigate for a job that best suits their goals so that they may provide the patients. He is also co-author of Mind Matters, a resource guide to psychiatrists for Black communities, How Amari Learned to Love School Again, ADHD, and Bree's Journey to Joy, a story about childhood grief and depression. As a native Houstonian, Dr. Higgins continued his educational goals and received his from Meharry College in Nashville, Tennessee. He completed his residency in adult psychiatry and his fellowship in child and adolescent psychiatry at the University of Texas Medical Branch of Galveston. He is a past of the Black Psychiatrists of America and past president of the Caucus of Black Psychiatrists of the American Psychiatry Organization. Dr. Higgins has worked with and founded many programs that help the direct inner city young men and women to aspire to go to college and finish their educational goals. He has worked with countless community members and has a special interest in trauma, racism, and inner city issues and how they affect minority and disadvantaged children. Please join me in welcoming Dr. Napoleon Higgins Jr.
Thank you so much, Clement, for giving such an extensive biography of myself. And I want to thank Tarina and Nia and all those involved in bringing me here today. It is great to be a part of this. And I want to make sure that we share some good information this evening. I won't hold you long, but I do want to share what we have here today. So I love Galveston. Been there. Lived on the island for a while, lived in Dickinson for a while, and then eventually moved up here to Clear Lake. Attended church there at Macedonia. I saw the last speaker you all had was the First Lady at Macedonia. And so it is great to be a part of this and to be a part of NIA and being able to share this information in this book. As stated, I'm in private practice in the Clear Lake area, Southeast Houston. Been in private practice since I walked out of UTMB Galveston for my residency and my fellowship in adult and child and adolescent psychiatry. So what I'll try to do is share my screen Or do you, oh, you have my slides up. Oh, wow. There you go. All right. Thank you so much, Tarina. So basically, the group that's bringing you the information we're talking today is Global Health Psychiatry. We are a group of originally 10 Black psychiatrists who got together with one vision, which is caring for the mental health and mental wealth of our people, of Black people. So understand that when we say mental wealth, I say mental health is being mentally well and then the ability to continue to grow. But mental wealth is the idea of not only being mentally well and being able to grow, but having that storage bank to be able to deal with the obstacles and the issues that occur in your life. As you can see, I'm on the bottom left side of the picture there with the boots on, and that is the rest of the team who helped to contribute to the books that we're going to go over today. We're going to focus mostly on, we're going to put more emphasis on depression and anxiety for what we have to discuss. Next slide. So we want to make sure that we empower communities. That is what this is about. By use of education and community action, making sure that people are not left out of what we're trying to do and of the mental health situation. We want to empower our communities. Next slide. And our first book is Mind Matters, a resource guide to psychiatry for Black communities. And the point of this book was to decrease stigma and fear and embarrassment, ridicule when it comes to overall issues in mental health. And that the book is written so that you can read it from cover to cover if you would like, but actually you can go to specific chapters, and each chapter is written independently, so where you can go to specific chapters and look up the mental health condition that you're dealing with. So we have chapters on depression, anxiety, bipolar, schizophrenia, substance abuse. We have chapters dealing with medication management. What is that about? Things you could do other than medications, childhood disorders, dementia and senility. All of that is included in this book. And the cool thing about the way the book is written on a question and answer basis, based upon the questions that individuals and families and patients have for us. And we answer it back as if we're talking to our grandmother. So Big Mama, Meemaw, Nini, whatever you may call her, is how we speak back. So in answering the questions, we speak it in about a sixth grade level. All right. So we take the science of mental health and we break it down to where it's to the point where it's read on the sixth grade level. And when you see that when you read the words that way, we take away the psychobabble and all the multi-syllable words that we use in medicine and use regular common language. And mental health sounds very different when you use common language. I've heard, so we wrote it for the patient and caregiver, persons interested in mental health, but I've even heard doctors say that they appreciate the way it's written because it sounds different when you hear it in regular common language. So often as doctors, the reason that people can't understand what we're saying is because we're speaking the information back in the language that we learned it, which is in the medical language that we learned it. But most, obviously most patients did not go to medical school, or nor are mental health professionals. So we write it back so it's in regular language. It's an educational tool specifically focused on African Americans. But honestly, if you read the book, you'll find that it fits for anybody. Everyone can have mental health. And we actually went down to the last minute on whether we would have the book be called A Resource Guide to Psychiatry for African Americans or Black communities, simply because anyone can read this book and you will not necessarily read that it's a Black book. But we wanted to focus and put that on the book so that Black people would read it. And we put strong Black faces on the front of the book. So hopefully that Black people would say that this will apply to us, because we're one of the least groups to actually go and get our mental health addressed. So that's what this book is actually about as you read through it. Next slide. So what we do is start off with the book on chapter 1, where we talk about Mind Matters in the intro in chapter 1. And in this particular series of talks that we do on this, we actually include Bible verses for every topic, realizing that when in the African American community, spirituality is so important in the African American community. And 95% of Black people go to church on a regular basis. I'm just speaking of pre-pandemic, go to church, and the majority are Christian. So we tend to have more of a religious or spiritual walk when it comes to our mental health. And so we included this in the book. And what I tell people is that too often we don't realize what the base word of psychiatry is. Psych and iatry. Iatry is the treatment of. So a lot of medical disciplines in with psychiatry or like pediatrics. So it's the treatment of, and then psych is actually psychos, the spirit, the wind, the ghost of the individual. So psychiatry is really in basic terms, the treatment of the spirit, the wind. And so often for many people, that includes this, obviously their spirituality. Next slide. So in the first chapter here, we have, what is a psychiatrist? All right, because that is the most basic question. And how do psychiatrists diagnose patients? So a psychiatrist is a medical doctor who specializes in treating people with mental health disorders, including anxiety, depression, and issues of focus and attention, anger, substance abuse, and many other things. So we treat mental health issues. I'm a medical doctor. I'm trained as a medical physician. I went to medical school and I trained in all these different disciplines of medicine, but my specific focus is on mental health. And so how do psychiatrists diagnose patients? Psychiatrists diagnose patients using the DSM-5. During the interview, the psychiatrists all ask a set of questions to understand your reasons for seeking or being brought in for mental health care. From a combination of initial complaints, the questions will help to get a better understanding of a patient's individual needs. So we're actually going, in a clinical interview, it is actually structured. We're not just asking questions, the yada yada, whatnot, and spend an hour of your time or 45 minutes or whatever. We're actually looking for specific things that we can help you with. What is the complaint, and how can I, as a psychiatrist, help you? Understanding that a psychiatrist is a part of a team. We're not all, for anybody in mental health knows that psychiatrists are not all in all of what mental health is. We're part of a team, and we're looking at what are the specific things that we can do as medical physicians with your mental health. Next slide. Understanding this, when it comes to mental illness, and we cover this in the book, not everything in mental health rises to be a mental illness. It's not until there's a level of impairment or a disability in function that a person is described as having a mental illness. So you can be sad and not be depressed. You can be, worried but not have an anxiety disorder. You can actually hear voices and not be schizophrenic. Understanding that people commonly hear things all the time, such as hearing your name being called. And you ask your friend, your mom, your dad, sister, spouse, whomever, you call me? And then they're like, no, I didn't call you. And you're like, you sure you didn't call me? And they're like, no, I didn't call you. And you're like, oh, okay then. Or did somebody hear the phone ring? Did my cell phone go off? Well, the fact is that we all have hallucinations. That's common. But illness is where the issue is, where you lose functionality, where you have so many voices screaming in your head that you become confused, that you cannot tell reality from not reality. And that becomes very distracting and keeps you from working and taking care of yourself and doing the things you need to do. So psychiatrists are part of a mental health team, so you could have a psychologist, social worker, pastoral counselors, best friend, good friend, mom that you speak to. But the fact is that we're part of a mental health team, and race nor culture exclude you from having a mental illness. So mental illness applies across all races. You can find it in all countries, and mental health conditions are common, and it does not mean that you are crazy. So often people do not realize how common mental illness is. I tell folk this: there are more psychiatrists than OBGYNs. Half the population admits to seeing OBGYN, but half of the population does not admit to ever seeing a psychiatrist, not to mention psychologists and social workers and other therapists and other parts of the mental health system that people engage in. So, there's this issue of stigma where we don't talk about it, but realizing that mental illness is very common. And I would go as far as saying it is extremely common because it's hard to get in to see a psychiatrist. We are the largest specialty field of medicine. Behind internal medicine, family medicine, and pediatrics, the most next common doctor is a psychiatrist. But also the problem with that, especially being Black, in that if you're looking for a Black psychiatrist, less than 2% of psychiatrists are actually Black, which is another issue of organizational bias and bias in medicine, bias in STEM, that actually decreases the amount of Black people who are actually who are actually going to be mental health professionals. Next slide. So a psychiatrist, we specialize In treating mental health disorders, we use the DSM-5 as basically as our guidebook, realizing there's a lot that happens in medicine and in mental health that go well outside of what the DSM covers. And then also we have to look at what is the urgency of your issue and the appropriate care and setting in which you need to be involved. Next slide. One great chapter that we have in this book is in the appendix on everything you wanted to know but were afraid to ask when it comes to a psychiatrist. All right. So we go through the questions that people have for us. What is the interview like, and what are the problems that people face? What are people afraid of? Next slide. So too often when it comes to psychiatry, it's so mysterious. People have anxiety and stress about it. Understand that, you can find a psychiatrist. It's easy to find one. All right. Now, to get in for an appointment may be a lot more difficult, but it's easy to find one. You can do a general internet search. I don't know, find a phone book, whatever it might be. We'll all be in there. But one of the problems that not all doctors accept insurance, and psychiatrists are the least likely to accept insurance, but you can find one who does. Just realize that sometimes it can take a while to get in to see the actual psychiatrist. Always have a list of medications when you go to your doctor. It is so much easier when a person has a list and they can hand it to me, or they brought their pill bottles with them, so we don't have to guess. When somebody tells me they take a white pill that's round, I have no idea what that is. All right. Or I take a blue pill that has little points on it. I don't know what that is because there's so many generics. They make them all kind of different ways and different colors. I have no idea what that is. So also make sure that if you're taking anything over the counter, the doctor needs to know that as well. Next slide. When the doc sees you, tell the doctor your story. And it's important to be honest. I tell people, if you tell me a lie or you don't tell me the whole story, the fact is that I won't know. I say it jokingly, but it's true. I am a psychiatrist. I'm not a psychic friend. So I cannot read your mind. What you withhold from me just keeps me from having a complete story of what's going on with you. And no, we do not judge you. Trust me, I hear so many stories that I have zero judgment in that. All right. I don't know. I cheated on my spouse. Or I don't know. I was sexually abused as a child. These are sadly common human phenomenon that it's rare for me to hear something new. The last time I heard something new was 10 years ago. So people do things. Bad things happen, good things happen. But trust me, we hear enough stories that we do not judge you. Understand that most, people worry about will they be hospitalized. Only 1 in 1,000 patients with a mental health issue will be hospitalized. The majority will not. If you want, you could bring somebody with you. You may want to check and make sure there's permission, because sometimes there's information you've left out. And when it comes to an individual with mental health, when you tell me your story, you're telling me from inside looking outward to the world on how you see it. When you have a family member, they're normally a close family member who's a loved one. There's a difference between somebody and who's a loved one. They're able to let me know how you look from the outside in. Like, how is your behavior impacting the ones around you? And then you're able to let me know how you feel about what's going on around you. So a lot of times it's good to have someone else in the room, especially if it's difficult information or difficult to understand. And sometimes it can be very scary to talk to a psychiatrist. If you have a serious medical condition, normally somebody says, bring a family member. All right. Why? Because they can better help communicate the information. They can help you remember. And understand that no information can be shared without your permission. So HIPAA laws are very tight. And honestly, because of what I do and hear so many stories, chances are your story is not going to surprise me. Every once in a while, somebody's had something very traumatic to happen. But I hear traumatic things all day, every day for the last 20 years. So it's, when you come in and I say get naked, and I'm referring to telling me your truth of what's going on with you, no, we do not judge you about that. And that is to your benefit to let us know what is going on. Next slide. So after your appointment, the doctor will discuss the issues with you. Depending on the psychiatrist's approach, they may recommend medication management, therapy, a combination of both, lifestyle changes. All of that goes into the actual treatment of the individual. And then it's important to follow directions and be honest about the medications. If you're having a problem, side effects or issues or questions, be honest. Sometimes you can't remember, write it down, because the more information you give the psychiatrist, the better we are able to help you. Next slide. So, depression. This is written by Dr. Delane Casciano. I wrote the first 2 chapters of the intro and What is a Psychiatrist. For his anger lasts only a moment, but his favor lasts a lifetime. Weeping may endure for, this is NIV. But Psalm 30 and 5, talking about the issue of depression, but joy comes in the morning. Next slide. So let me read this one to you. So we're supposed to talk mostly about depression and anxiety. I could talk about mental health probably end on end until, tomorrow and the next day. But Vivian is a 35-year-old divorced African-American female who was referred by her primary care doctor to a women's mental health center. She arrived for the visit alone, neatly dressed, and with a polite but hesitant approach toward the front desk staff. Although she appeared nervous at the start of the interview with the psychiatrist, she progressively appeared more relaxed as the discussion continued. When asked how she was referred to the Women's Center, Vivian stated that she told her primary care doctor during her annual visit that she had been feeling stressed out for the past several months. Her primary care doctor told her she had depression and referred her to the Women's Mental Health Center. So understand that, most often primary care treats more mental health than psychiatrists do, because that is the entry point into health. And that's where a lot of mental health issues are picked up. But understand that just because you're stressed does not make you depressed. Everyone has stressors, but not everybody becomes depressed. Realizing that depression is the medical condition where you're not functioning at your optimal. Because as I stated here, depression, doesn't everybody feel this way sometimes? Yes, we all have our ups, we all have our downs, but when it's sustained and starts to impact function is when the depression needs to be further looked at to see if it's a clinical issue. Next slide. So all individuals experience a range of emotions, including depression, but it's when a person's feeling happy or sad, but when we say depression as psychiatrists, it's not in the context that most people are talking about. We're talking about clinical issues that are treatable medical conditions. Understanding that when you have clinical depression or major depressive disorder, this is treatable about 90% of the time, 85-90% of the time. With proper treatment, those symptoms can go away. All right. So far as you may feel sad or down or up or which way or the other, but we can treat depression. We have so many options in treating depression that normally it's not going to be a debilitating issue. And if it is debilitating, typically we can get it much better than if you're not receiving any treatment at all. Next slide. So symptoms of depression is when a person is having difficulty enjoying things, having a depressed mood, changes in appetite, energy, concentration, a slower movement so far as not moving much, being restless and fidgety, guilty or worthless feelings, hopeless or suicidal thinking, and the person is having difficulty functioning. As always, it's an issue of difficulty functioning. And we go through in the book all of the symptoms of depression and give you examples of that in the question and answer format. Next slide. So now another frequent thing that we confuse for depression is the issue of bipolar disorder. And the reason that is, bi means two. There's a high pole called mania and a low pole called depression. And there's all these individual behaviors in between. And so often people will come in complaining of depression, and about 1 in 5 of those people probably have bipolar disorder. So, so every time we write a chapter in the book, we always started with the question or a colloquial term. So bipolar disorder, why do people keep telling me I'm bipolar? All right. So essentially people are noticing that something is going on with this individual. I told my doctor I had mood swings. He told me I have bipolar disorder. So bipolar disorder is one of the most challenging and difficult disorders that psychiatrists treat daily. In this chapter, we will discuss what it means to have bipolar disorder. We will talk about the different ways to treat the disorder, as well as answer questions about how the disease is diagnosed. In every chapter in our book, we actually have an example of what the illness looks like for a person, realizing that we created all these stories. These are not any specific individuals. So Trinity is a 38-year-old Black female who came in for an evaluation at the partial hospitalization program after being referred by her job. She presented with complaints of episodes of severe depression, stating, Something is wrong. No matter what I do, my mind won't stop racing and I can't sleep. She stated that she couldn't go any further and wanted to give up on life. Her job as a mid-level executive is extremely stressful with deadlines, but over the past few weeks, she started volunteering to take on multiple tasks at work. She was also commended for her extreme work ethic, but noticeably was becoming increasingly busy, friendly, chatty, and talkative when she had previously had been more reserved. She returned to work elated and bragging about how she was able to complete a business-related 3-week online training course over an extended three-day weekend holiday. Her supervisor said, "There is no way you could have completed that class in 3 days. You must have gamed the system." Trinity immediately became irate at the accusation and screamed in a staff meeting, What? You think I had to cheat to get this done because a Black woman can't be successful? I've been busting my expletive all weekend, been up 24 hours straight for 4 days without a drop of sleep to make sure this project was ready for you, ungrateful idiots. And this is all the thanks I get." She continued as she became angrier. She began yelling to the point that her speech became unintelligible and they could not understand what she was saying. So the issue is that most often than not, most people with bipolar will complain of depression, but so often we have to screen for the manic symptoms because we don't want to miss that diagnosis. And it has many treatment implications if you miss the diagnosis and call it just depression when it truly may be bipolar disorder. Next slide. So bipolar is a brain disorder that has unusual shifts in mood, energy, and activity levels that can be from very sad and down and depressive episodes to hyper busy and extreme mood swings that you find in manic episodes. Next slide. So a manic episode is a week or longer period of elevated mood, doing more things, chores, being impulsive, engaging in pleasure-seeking behaviors like sexual decisions, spending excessive money, and then talkative, can be very talkative and not needing to sleep. And then depression looks the same as with major depressive disorder, except that also either now or in the past, bipolar disorder is the hallmark of you've had a manic episode sometime in your life, or you may currently be having a manic issue. Next slide. All right. And then we're on to anxiety. So is this just nerves? I'm not crazy. I just need something for my nerves. Psychiatrists and other mental health providers Psychiatrists and other mental health providers hear the preceding comments daily. In this chapter, we will explain what anxiety is and why it causes so many problems in our lives. We'll address the different kinds of anxiety, how mental health providers treat these issues. Overall, people more often present with problems caused by anxiety compared to any other mental health disorders. Anxiety is the most common reason that people seek help. Many people describe it as having nerve problems or being a worrywart. In the African American community, anxiety disorders are 20% less prevalent than in Caucasian communities. In addition, women have found to be more likely than men to be diagnosed with an anxiety disorder. There's no single reason for these differences. Knowing and understanding when an individual needs help and a person's ability to cope and deal with stress are all part in the reasoning. So what causes anxiety? Anxiety does not necessarily have to be caused by anything. Anxiety is often a normal reaction to stress. In some cases, it can be useful because it can help alert a person to a strange or dangerous situation. However, an anxiety disorder is not helpful and usually causes some problems in your life and can affect work or school. What are the different types of anxiety disorders? Panic, agoraphobia, specific phobias, social anxiety disorder, and many others, including PTSD, are very common. So the most common diagnosis in mental health is actually anxiety. Next slide. So anxiety disorder is the most prevalent common disorder in mental health treatment. African Americans are less likely to complain about it, but also do have issues with anxiety. Now, understanding that this was written before the COVID pandemic, but also you have to look at this was written before George Floyd, all these social unrest, and basically people putting cameras on what's going on with policing and things of that sort. So anxiety is normal, but it's when it causes issue. All right. It's when it impacts your ability to move forward or to grow or to do functional things during the day where we say that it is an actual disorder. Next slide. And these are the different types of anxiety disorders: generalized anxiety, panic, agoraphobia, social phobia, and specific bias and PTSD. And specific phobias like fear of heights, fear of spiders, fear of the dark, fear of closed spaces and elevators. All of those are listed under anxiety disorders. Generalized anxiety is where you worry about everything all the time. So it takes up a lot of your day and you can't get things done. Panic disorders are where you have this fight or flight symptoms where all of a sudden you feel afraid or scared, like you're about to die. You need to break away. You need to get to safety. Agoraphobia is the fear of embarrassing yourself. Sometimes it can happen in open spaces or a lot of people are around, the need to escape. Social anxiety is the fear of judgment, where people avoid meeting people that they don't know, may avoid a job interview, or avoid social situations where they fear that they'll say the wrong thing, do the wrong thing, can be under extreme fear when it comes to speaking in front of individuals. And then post-traumatic stress disorder is where you have a traumatic experience, and then afterwards you develop a stress disorder or nightmares, flashbacks, recurrent thoughts, increased startle reflex where things make you overly frightened very easily. All of that is part of what occurs in anxiety disorders. Next slide. As we already talked about PTSD and trauma, I'll go through this one very quickly. PTSD and trauma. Next slide. So having a dangerous experience that should cause anxiety that puts threat to yourself or others around you. Next slide. So medical professionals, oddly enough, COVID-19 is going on. So a lot of medical professionals have, watching people die is very difficult. Civil servants, as far as policemen, firemen, paramedics, obviously the military will have a lot of trauma, but also what we don't talk about is adverse childhood experiences. A lot of people have PTSD from physical, sexual abuse, or emotional abuse as a child, realizing that 1 in 4 girls and 1 in 6 boys, or 1 in 7 boys will have issues of being molested or raped before the age of 18, which is a very high number of individuals who have these adverse childhood experiences who've experienced trauma at a very young age. Next slide. Substance abuse and addiction. Next slide. Realizing that substance abuse can be chronic, where a person may always have an issue, relapsing, drug seeking, and they will have this drug seeking behavior despite harmful consequences that they can't let it go. Realizing that we all have the risk of addiction so far as motivation and drive. The problem is that with addictive disorders, this motivation and drive is having a harmful consequence with the behavior. So a person who, say, smokes weed or even smokes crack, if it's not impairing your life and you're not having any harmful consequence, then the fact is that, you have to really question, is that an addiction versus a habit? So we have to look for the harmful consequences of the behavior and that the person can't stop despite it destroying their lives. Next slide. So it's not just drugs and alcohol. Internet, sex, gambling, shopping, video games, overeating, all of those are at risk. But the biggest cause of death from addiction is the use of tobacco and smoking, and that we do not pay close enough attention to the fact that cigarettes and smoking tobacco kills more people than all other drug addictions combined. So put crack, alcohol-related crashes, all that together, and smoking cigarettes and tobacco will cause more deaths. And the fact is that people believe vaping is safe, but it is not. It heats up the tobacco hotter than actually burning the tobacco with a cigarette or a cigar. So all of these things have the high risk of death, understanding that about 1 in 5, 1 in 6 people who die from smoking are dying from secondhand smoke. And what we're finding is that also people are having issues with secondhand smoke from vaping. So people think that vaping is benign because we can't smell the cocoa strawberry lavender flavor, which I can't stand smelling somebody else's smoke, even if it's coke, lavender, strawberry, whatever. But the fact is that this secondhand smoke is also causing issues too. Next slide. Childhood disorders. Next slide. So these are our 2 books on childhood disorders, Bree's Journey to Joy, and also How Amari Learned to Love School Again. These books are written similarly in that there's a story. We use beautiful Black faces and Black families to tell a story of mental health, impairment, mental health, doing well, having impairment with mental health, but then how do we get back to restoration, and how do we get the person to move forward in life? And in each book, we also have a parent guide in the back that goes more in depth on the illness itself. So the reading level of the book is on a second, grade level of the book itself. But then the parent guide is written just like in Mind Matters, where we wrote it for Big Mama. So the point is that the parent guide is written on a 6th grade level. So an 11, 12-year-old should be able to read this book, both of these books, and be able to comprehend the information in them, and that it's written on that 6th, 7th grade level. Also, now Bree's Journey to Joy, oddly enough, was supposed to come out in March of 2020. We had a big conference that we normally launch our books at. It's supposed to come out March 2020. Obviously, March of 2020, COVID pandemic happened. So our plan was to push it back into the summer. And then we planned on pushing it back to Christmas. But because the COVID pandemic kept growing, we actually had to redo the book and put the pandemic in the book, because we had written a book about grief and depression for children. But COVID happened. Now we had to put COVID in the book for the book in the book. So realizing the original book, she did not have on a white coat. She did not have on goggles. All right. But we wanted to give an ode to our medical professionals, and we added the COVID virus to the actual book. Next slide. So childhood disorders are where children also face issues with significant behavioral changes. All right. Where people will say, well, kids can't have mental illness. Well, that is not true. 2/3 of all mental illness occurs before you're the age of 18. 2/3 of it happens before you're an adult. So school performance, family participation, issues with friends can occur, and genetics, maternal exposure to drugs, socioeconomic factors, all of that goes into the totality of the child, realizing that they are a factor of nature and nurture. Both go into who this child is. Next slide. So evaluation is important. We have to be very strategic and be safe with medications, because children are not just small adults. They have a different physiology, and we have to take that into consideration. And that their livers work faster, but the kidneys work slower, and they have a smaller body of volume and of their physical nature. But also the understanding of information can be very different for a kid, especially the younger they are with the limited vocabulary. So a lot of times when a kid can't explain what's going on, it's because the kid does not have the vocabulary for what it is. And it takes a trained professional to try to tease out what is actually going on. Next slide. A chapter on dementia and aging. Next slide. And so dementia often is referred to as issues of memory and thinking, but not all dementia is Alzheimer's. A lot of things, strokes and strokes and other issues can cause symptoms of dementia as well. Next slide. Declining memory, forgetting dates, not being able to live on their own, difficulty with problem solving and reasoning, all happen with dementia. Next slide. And then there's the caregiver stress, all right, that comes with dementia, so far as caring for someone who is your parent and they're not themselves, because dementia has taken hold. They can seem very different. So it's very stressful, and a very high rate of depression occurs in people who have to care for their demented family members or relatives. Next slide. We have a chapter on medication management. So yes, we talk about medications and how they work in common terms and what they're trying to do with the brain. So it requires a complete psychiatric evaluation before prescribing medications. You have to have informed consent, and that the doctor has to tell you what the medication is for and what can be the problems if we take the medication, what are the side effect issues you have to look out for. Next slide. So doctors should tell you what it's for, what it's supposed to help with, most common side effects, and other treatments, giving you options other than medications of what can help treat your mental health condition. Next slide. And then we included a chapter on things that you can do outside of medications, and that people say the psychiatrists just drug everybody up, realizing that there's a lot more going on to what we're thinking before we write a medication. Next slide. There's prayer and spirituality, and that there is health, improved health by believing in a higher power, in your God, or whatever you may call that individual, to improve your health. Prayer does help. It may not fix a broken arm, but it can actually help you. Maybe prayer can help you from breaking it again. But the fact is that there's health and healing in spirituality and your network of your life. Next slide. Psychotherapy and talk therapy. I would say at least half of my patients or more I do recommend for therapy. That is a very important part. The medication will not do anything about your childhood experiences. So if you were molested as a kid, I can give you medication. It may help with nightmares and flashbacks and symptoms of PTSD. It may help with your depression, but it will not change the sexual abuse that you may have received from the ages of 5 until 14. It will not do anything about your bad relationship that's going on right now. It may not be able to affect, medications won't affect or change your relationship with your spouse or your children, but therapy definitely can. So some psychiatrists do therapy, but more often than not, we refer that out. Next slide. Important things for your mind: your sleep, meditation, yoga, deep breathing, exercise, nutrition, understanding that all of that goes into your mental health, and the chance that I'm going to hand you a pill and that's all that you need to take in order to be well is very low. It's like being diabetic. I'm going to give you this medication, all right? But it does require that you change up your eating habits, your sleeping habits, all of that, what you eat, what you can consume, exercise, all of that goes into your mental health. And I tell people, whatever helps the heart helps the mind. All right. So exercise, good nutrition, sunlight, good friends, all of that is helpful for your overall mental health. Next slide. Schizophrenia and psychosis, and we're almost done. Next slide. So what is a psychotic disorder? It's basically, it can be a whole host of things. A lot of things cause psychosis, from being high, coming off a drug, medical disorders. All these things can cause psychosis, but schizophrenia in itself is an issue of a thought disorder. So when we're looking at psychosis, it's not whether or not you hallucinate, it's how your brain is working and thinking that the psychiatrist is truly keying in on inside on that diagnosis. And as stated, it's when it causes impairment that we have concern. Next slide. Next slide. All right, so those are our 3 books right there. Mind Matters, a resource guide to psychiatry for Black communities, How Amari Learned to Love School Again, and Bree's Journey to Joy. One thing I would like to do is, can I share my screen? Is that allowed? Let me see.
I think you should be able to. Let's give it a try. So I'm going to remove this one. And also, thank you for the presentation. That was a lot of really rich information.
Thank you. Thank you so much. I appreciate being able to be here. And I'm going to see if I can share this screen here. And I'm going to run through Bree's Journey to Joy, story about childhood grief and depression. Let's see. All right. Can you all see that picture there? There's you should see a big afro. There you go. All right. This is Bree's Journey to Joy, a story about childhood grief and depression, written by Mind Matters. And what we do here is that we have a dedication here, realizing that we lost a member of our team, one of the original writers, and the person that came up with the concept portion of half of the concept in minimal of what we did. He passed away. He had diagnosed with cancer. He was told that he had 3 months. He lasted about 15 before he passed away. So we have a dedication to the left. But with all of our stories, we start off a picture of the child being whole. So my name is Bree, and science is my superpower. Next slide. Oh, that's on me. My bad. And so basically, a normal child, she loves going to school. She gets up, goes on her way. She teases with her grandmother. Her grandmother's her best friend. Her grandmother takes her to school. She has a very close relationship with her. She loves science and all that comes with that. She wants to be a doctor. She wants to grow up and to be a doctor. So she goes on spring break. And when she gets home, as she's preparing to go off, she noticed her parents are very sad, and they let her know that her grandmother was very ill, and the hospital seemed to be so big and scary. And so often as adults, when we're dealing with these issues, we often forget the impact it has on the child themselves. And so Nana was sick. Bree wished to hug her, but she could not touch her Nana due to her illness. Realizing that in this COVID setting, this is very strange, where people are dying and passing away, but no one can be with them. No one is near them or can't touch them. So Bree's Nana died. Bree felt sad and full of many emotions. She missed her Nana so much. And so with the loss, our parents are trying to console her, but realize that the parents are hurting as well. But a lot of kids, they miss more than just school. They miss more than just loved ones. They're missing school and being around their peers. They're stuck at home. One thing we don't pay attention to is sensory deprivation, with kids being at home and stuck in the house. And other people are not there. People are busy, and sensory deprivation and not being able to be around friends. So because her teacher noticed that her grades were dropping, they took her to see someone, a psychiatrist, realizing a lot of us do telemedicine now. And after doing those things, they started doing the things they would normally do. And this is an example of Bree showing a story and pretending to be her grandmother. And they're able to in their recovery, be able to think of the good times and the good days, and to be able to share things with one another. And she goes to her mother, and she's interested in getting herself back together and how she looks. She wants to do well in science again, and she wins a science award. She starts to play with friends, and that is the end of the story. So she got her superpowers back, and you can see the flowers blooming. We use the flower as a metaphor throughout the story in order to tell the story. And then in the back, we have the parent guide. So like we have question and answer with Mind Matters, we also have question and answer with our children's books. So conversation starters about the book. What is grief? Do children have grief? What can parents do and caregivers do to explain death to a child? And we go through the multiple questions that individuals have when it comes to overall mental health and depression and taking care of kids. I had one of the most wonderful discussions about this book, which is a person did a talk and reading of this book at an elementary school, and two kids in the room, it was kids from the counseling office, and two of the kids had lost parents very recently. And they talked about how one girl asked a lot of questions, and she was very talkative. And at the end of the conversation, the school counselor and the teacher told her that is the most that they had ever heard her speak about the loss of her mother, ever. All right. By reading the book and seeing a child that they could identify with, realizing we picked a brown skinned kid, and we also called her Bree because Bree is a very common name, in order that individuals can identify with who they're looking at and who they're talking to. So in another testimony that that an individual said is that we get a lot of compliments from adults about the book too, because realizing that we were all kids, but we all have loss, and loss adds up, it stacks up. And so the point is that the person was saying how much they had an issue with dealing with something, a loss of someone very close, for 20 years, and they never quite knew what was going on, why they were having these particular problems and issues. So by knowing and learning, they were able to do the steps they needed to do to recover from the grief that they had when they had lost a very close loved one. So that is all that I actually have to offer, regarding what we're talking about today. I'm more than willing to answer any questions that you all may have.
Yes, thank you so much. And so I've opened it up in the stream for people to share questions. They might have questions that come. They watched your presentation and also got to learn a bit more about the children's books that you've written. And so, Clement, if you see questions, feel free to hop in and field those to Dr. Higgins. And in the meantime, I have like one or two questions that I want to ask that I think would be really useful for our viewers. One of them being, one of the biggest issues that we've heard is the need for more Black mental health providers. And I know that you'd mentioned some of those systemic barriers within just the practice that have resulted in seeing less Black mental health professionals. What advice would you give to people who they don't want to give up looking, but they at least can manage their expectations knowing that scarcity is there? But I guess where would you direct them if they were like, I still want to to pursue this. I still want, a Black male psychiatrist, which is also another thing that we've heard through the solitude sessions of people having a really hard time to find.
Honestly, it's very hard to one place that it's easy to look is Psychology Today. They will have a lot of therapists, psychiatrists, social workers, anyone in mental health who's clinically has a license to see patients. That is the best place I would say to go. Obviously, word of mouth. If you know a Black doctor, and most Black doctors will know a Black psychiatrist, realize that it can be very difficult to get in to see one of us. You can make an appointment in my office. There's 3 Black psychiatrists here. So you can find one. It can take a while, but I tell people if you can't get in to see a Black psychiatrist, get in to see somebody. Most psychiatrists are trained in culture and should be able to take that into mind. Not every psychiatrist may be very good at that, but if you find somebody who's good is taking care of your needs, that's fine and well enough. And they may not be Black, but they may be very good. So I would say the more important thing is to get in and to get taken care of. It's great to have somebody culturally competent, but the more important thing is to make sure that you're taking care of your mental health.
Thank you for that. And the next question that I'd like to ask is just knowing how high the demand is for more Black mental health professionals, what advice would you give to someone, whether they're an undergrad or a graduate student or a high school student, or does they know that that's what they want to be when they grow up, between where they are now and the point B of hopefully being a really responsive, effective mental health care professional? What advice would you give them as far as pursuing that as their goal?
Well, we definitely need more Black mental health professionals. And when it comes to medicine and psychiatry, realize that psychiatry is a STEM, medicine is a STEM career field. So the issues that we have really start back in the 3rd grade, where you see a split in what classes different kids take, who's gifted and talented and who is not. And so often Black people are not on those lists for a multitude of reasons, including issues just flat out racism and prejudgment. The other issue with creating, say, a me is that it takes 15 years to create a psychiatrist. So the investment has to be done early on, so essentially investing in Brother Clement here is, hey, yeah, we need Black psychiatrists, bro, come on, but the fact is that so often we're cut off well before then. Like about 3 or 4 years ago, I want to say it was only 300 Black men got into medical school across the whole country. 300, all right, 300. I'm like, well, how many psychiatrists can make out of 300? When, of course, we need Black orthopedists, or orthopedic surgeons. We need Black pediatricians. We need Black anesthesiologists. We need Black everything. So, it becomes an ordeal to create more, but we can. So focusing on those early career classes, for high school, you need to focus on your STEM type stuff. When you go off to college, making sure you have a good academic advisor. So you may want to major in science, but you may want to major in something else. You can major in English and still go to medical school, but you still have to take the science classes. And then, of course, residency and trying to recruit early, making sure that mental health is on our minds. And I'm thinking that the more we talk about mental health in the Black community, maybe that will help produce more doctors so that I don't seem like a strange individual. Currently, I'm like a unicorn. But if you've seen a unicorn is no longer strange to you. Well, I saw a unicorn. And then if you saw one unicorn, you're probably going to see another one. All right.
Right.
So now it's okay. Well, unicorns are happening all the time. Maybe we can make this more common. So I've been exposed, and because I've been exposed, I'm no longer afraid. I'm not thinking that that's not something for me. No, I can be a psychiatrist too. If that dude can be one, I can definitely be one.
No, I love that. And that's such a useful answer. And especially when I think of achieving together, there's this saying that my executive director, Sue Johnson, loves. And we heard it, I think the first time we heard it together was from the Hogg Foundation. But if you want to go far, go alone. No, if you want to go fast, go alone. If you want to go far, go together. And I think there's a lot that it can attest to when we think of just seeing people succeed together, people make it through achieving things together, and then tending to. Oh, go ahead.
And all mental health is not psychiatrists, so you have the PhD route with psychologists, you got social workers, you got school counselors. All of those are routes to helping people with mental health, and they are all extremely important. They are all extremely important, and they all have a dearth of blacks and black men as well.
Yeah, definitely. And so I'm peeping at the live comments, and I don't see. Oh, there's one from Josh Miller. Clement, if you want to share that one.
So it says, what programs or things have you, I can't see. So what programs or things you have in place to draw the interest of the youth to teachers? So I think they're trying to get at like what kind of pipeline programs maybe are there maybe at the high school level, at the college level to kind of recruit.
Definitely. Well, one, so far as the work that I'm doing, I'm always trying to promote, trying to get more, black kids education. Obviously I mentor several people. Ask me a question, I'm more than happy to answer it. And then I do work at Prairie View, and I went to Prairie View as pre-med, which is the highest producer of blacks into medicine in the state of Texas. So basically they have a pipeline, and they have a machine that cranks out black doctors. I'm a big believer in HBCUs. 75% of all black doctors went to an HBCU. So sadly, now I know plenty of black doctors who went to white schools, but HBCUs tend to be more effective than white schools in getting black people into medical school. Now it starts high school as well. STEM, science, taking the hard classes, taking the upper level classes, being able to get the patterns down on how you study and read and focus and knowing how to manage time. And too often, a lot of people want to go to school or go to college. You're not even prepared to go to college. I had a program in Macedonia, and I found a lot of our top students weren't able to pass, the basic college entry exams and had to take remedial work, even though they were good students who finished from Ball. You're an AB student and you're not prepared to go to Galveston Community College. Now, most of them finished college, all right, but obviously to me, your high school failed you. So you got to be in the mindset, I've got to be in the upper level classes to be prepared, but that starts in middle school as well, but that goes back to elementary school and then even back to childhood. There are ways to make you have a smart baby. One is talk to your child and read to your child. Your baby can hear you inside of their stomach, but the biggest predictor of a child's IQ is the mother's level of education. Why is that? IQ is based upon the ability to learn information. Your mom's education means that she uses bigger words. So when you hear them later in life, you've already heard those before, and you grew up in a house that spoke of that. If you don't know big words, you could take earbuds to your stomach and have somebody else to read to your child if you want to do that. Reading to your child at a young age, and honestly, if your child cannot read before they go to kindergarten, that's because you didn't teach them, because children can learn to read at 2 and 3 years of age. You can teach your child to read. The reason they start school at 5 is because they're potty trained by then. But you can already teach them that. They can already learn how to count, add, subtract, multiply, and divide at an early age, up in kindergarten, first grade. So the point is, we've got that pipeline starts early. It starts early in the womb all the way through, because we need more black professionals, period.
No, I love that you bring that up, because it makes me think of like especially when we look at in Galveston, right? Like the reason we curated your session specifically, your reading specifically, to do in collaboration with Soul Food Sessions, is to address some of those disparities in not only Black mental health in Galveston, but in Black health outcomes, the disparities in Black health outcomes overall. And so, as you mentioned, that the importance of early literacy for our kids, there's an initiative, Harambe for Galveston's Youngest Citizens, that we just kicked off that's focusing on the Black families with children ages 0 to 3, and the importance of, like, we have all of these resources, but are these resources culturally responsive to Black families? and how can we take input from Black families, make them more culturally responsive, make the resources more culturally responsive, so these parents are learning that information, because a lot don't know. Even things like, if I really appreciated you mentioning your book being written, at a 6th grade reading level. It's something that should be accessible, even if someone doesn't have strong literacy. But with children's books, it's even smaller than that. So no matter how strong someone feels their reading skills are, or even if they didn't finish, college, you can still go to the library, get those baby books, and give your kids a really good future. And so I really appreciate you you sharing that with us, and deeply appreciate everything that you've shared with us tonight. And I really can't think of a better note to end on, aside from thanking you, and thanking everyone who joined us tonight. Thank you, Clement, for joining us. And if you were just like, oh my gosh, this reading was so great, when are you guys doing more of this? The answer to that question would be tomorrow. And so you can join us. We'll be having Tommy Boudreau and Alice Gatson sharing their book. It'll be a presentation as well, because it's an image-driven book, but same time, same place, Nia Cultural Center's Facebook, YouTube, and Twitter. And we're so excited to see you all there. And so again, thank you so much for joining us tonight. Thank you so much for the questions, for the knowledge, for the participation, and thank you for just being part of our African American read-in. You all have a good night.
Thank you.
Thank you.